Hi, my name is Anna and I am your occupational therapist today. How are you feeling? All right, yeah, I can see that. I'm sorry. Well, your doctor actually referred me over to you so that way we can treat what we can and prevent you from having a stroke. I wanted to let you know that I don't want you to be scared, but you do need to know that once you have a TIA, a transient ischemic attack, you are more likely to have a stroke. So it's important that we understand what a stroke is, what it can cause, and then what we can do to prevent you from actually having a stroke, because there are some ways we can decrease your chances. All right, how does that sound? All right, that's good. So, what I want you to know is a stroke is a cerebral vascular accident that occurs in the brain. We call it a CVA, right? And it stands for that. And basically, it's caused by one or two things. Mainly, it's either a ischemic attack, which is when the brain is deprived of oxygen, and the brain needs oxygen, and it causes some sort of embolism that happens anywhere in the body, which is like when your artery basically bursts and then, there's no more oxygen to the brain. The other way is a hemorrhage. So basically, a hemorrhage is when there is blood that spills all over the brain and it damages the brain cells that we need in order to function. So there are different dangers of a stroke. There are motor impairments, so it can lead to weaknesses in a certain part of the body, mainly in one side of the body, depending on where your stroke is. So it seems that if you were to have a stroke on the left side of your brain, your right side of your body will feel that. You will have maybe some weaknesses or some paralysis, but it's not just those motor impairments. There are different impairments as well, such as speech difficulties, cognitive issues, sensory such as visual and perception issues that can occur, even some personality changes, and that really impacts your whole life. So, one way that we can understand that a stroke is happening, because it's important that we act very, very fast. If you were to get a stroke at home, this is what it would look like. There's an acronym called FAST that can help you remember what's going on. So F stands for facial drooping, A stands for arm weakness, S stands for slurred speech, and then T stands for the amount of time that we need to act. So can you repeat to me what FAST is, or do I need to repeat it to you? Because I really need you to remember this. Okay, yes, that's exactly it. So remember, FAST. Next, in order to prevent you from having a stroke, this is what we need to do. There are things called modifiable risk factors, which are things within your control that we can motivate you to engage in. So this is your body. This is your actions, right? You take care of your body. So things that might increase your risk of having a stroke includes smoking, sedentary lifestyle, alcohol, drugs, and lack of exercise, hypertension, and then if you have diabetes, managing your glucose. So these are all important things that, like you as a client, you really have to look out for in order for you to maintain all of your functioning and your ability to do the things that you love to do. All right, so let me know if you have any questions. I'll be around, and yeah, we'll go from there. Thank you so much for your time. All right, bye.